Imagine being 18 years old, looking to make it into your new country. To get into high school, you need to have a physical that you never had before. The doctor tells you, Arturo, you need to go to the emergency room right now. You have a blood pressure that we need to get it under control. Arturo looked at me in shock, devastated. He tells me, what do you mean? ¿Qué quieres decir? I don't know how to get there. I don't have any money. I don't speak English. Can I go later? We have heard this countless times. We know if he doesn't take the treatment that he needs, he could die soon. We offer a solution. We will drive you. Early in my career, I was surprised to see so many people from community of color lacking access to medical care and social services. I knew I have to do something. I founded the Latino Health Insurance Program to improve access to medical care and food, and to improve health literacy for minority communities, while we also reducing medical costs. Our diverse multilingual staff provide assistance with a variety of services, medical care, social services, and some of our programs, like the diabetes prevention program. We offer these services in our 3 locations, in Framingham, in Boston, and in Worcester. Latinx and African American are at higher risk for developing and dying from diabetes. People, 1 out of 3 people from Latin American origin will develop diabetes. 9 out of 11, they are pre-diabetic, but they don't know it. The American Diabetes Association reports that the medical expenses for people with diabetes is 2.3 times higher than those without. In Massachusetts alone, these costs exceed $5.5 billion annually. And with a reduction, what we say, and a loss of productivity for above 2.1 billion. Our organization is committed to saving lives and to reduce this cost. This is our model of change. First, people come to us, like Arturo, without having a physical. These individuals also, in his case, because he didn't have a last physical done, his diabetes was threatening his life and stealing his eyesight. Our services for our communities, they come to us, our client, patients, whole families, looking for assistance for food, shelter, and fuel assistance, medical coverage, and other services. Our patient navigators, some of them who are here, they provide these services that these individuals need. We also have an important aspect to our work that is to educate providers, physicians, health centers, hospitals, so they know about our work. Many of them, so we are filling an important gap for these communities because our cultural and sensitive care, many of them, or many of these organizations and providers don't have the capacity to meet. We provide preventive care, so some of our programs like cancer screenings, vaccines for adults and children, and just last year, we provided 5,500 COVID-19 vaccines. We also wanted to say that educating people with these conditions reduce the risk and also minimize the disease progression. Our long-term care and long-term support and advocacy provide these individuals the tools that they need to become empowered and to take the health and wellness into their own hands. The result is getting these members of this community engaged and healthier, so we can all have healthier communities that our community members can thrive. Diabetes has serious health consequences. Like you see in this photo, and I'm sorry if I become emotional. This is a 55 years old woman from Hispanic origin that she lost her leg due to diabetes. She wants us to share her story so other people doesn't have to face the same devastating consequences that she had. Education and health information are important for disease prevention. So our evidence-based education programs, a year-long, are being accredited by the American Diabetes Association, recognized by the Center for Disease Control, and certified by the state of Massachusetts. Not only this result has been validated by our Department of Public Health, the positive outcomes, so people in all those age groups have lost their weight and are reduced their A1C. We not only have the data, we also have their smiles to prove it. Since 2006, we have served 95,000 people in Massachusetts. Last year alone, we helped 10,000 people to apply for medical coverage. And 2,400 individuals have been served by our diabetes prevention efforts, with an estimated reduction on $24 million in ER visits. Our vision is to increase our capacity by strengthening our foundation and expand our network of providers for the next 2 years. We wanted to create a virtual diabetes control and management center, license our evidence-based education programs, and offer this program in other languages. We wanted to connect 28,000 individuals with medical care and access to medical coverage. We are seeking your support. We are seeking $2 million for the next 2 years to support our work. Let me go back to Arturo. I wanted to share that Arturo is working now with an ophthalmology and a specialist to preserve his vision. We also wanted to share that Arturo has a controlled diabetes and hypertension. We also wanted to say that Arturo is in high school and planning his future as a mechanical engineer. We wanted to ask for your help so more people in our community, like Arturo, can have equitable access to medical care. Thank you so much.